Normal means you fit into the box of what these reference ranges look like. But really, what are these reference ranges? These reference ranges are what is the normal for the amount of people they take a sample of. These people are not the healthiest people in our society. They are just the common people in our society. So, is that normal for you? Who knows? We don't know that because if you don't feel well and you're having symptoms, then that number's not your normal. So, when I first opened Hometown Primary Care, I opened as a hybrid direct primary care office. So, I took six insurances because they were the most common insurances in Oklahoma. So when I decided to do that, it was based on the fact that we live near an Air Force base. And so I knew most people and teachers and state workers had those insurances. Now, as we started moving forward, most people, when they called, they did find out about direct primary care, but most often, of course, they were like, well, do you take my insurance? And we did take six insurances. So once we were like, yes, we do, most of the time the discussion about direct primary care stopped. So while I really wanted to focus on direct primary care, that didn't seem to be the way things were going because the least important question became the most important question for patients of instead of do you care for me, will you help me, can we get to the bottom of anything, it was do you take my insurance, which is a great model for insurance, a horrible model for your care. But that was what happened. And so, slowly but surely, over the first year, year and a half, I started seeing much more insurance based patients than I actually ever set out to see. So, within about the next 6 months to a year, it got so busy, I had to hire someone to do the billing because I had been doing it myself. And at that point, I was paying someone to collect money. I was not being reimbursed by insurance to the extent of what we were told we were going to be reimbursed because you have a contract with them and you have to do what they say. So if they send you a piece of mail that says, we overpaid you, we're going to need all of that back. You have to write a check. Like that's what happens. And so whenever that started happening, and then we started having issues where we would get 19-cent check or a 3-cent check or nothing at all. And I was seeing 60 patients a week and I wasn't making enough to even pay our bills. I was like, I don't really even know how we got here. Like, this was not my goal to begin with. My goal was to take care of patients, to see them, and for them to see the amazing things that direct primary care offer. And somehow I had just gotten right back into the rat race of insurance based 15-minute in and out patient care. And I was like, this is not where I started. This is not where I want to be, and it's not where I'm going. And so at the point that I started looking at it and I was making about $2,000 a month from insurance and seeing 300 patients a month, I was like, this does not math. Like I'm not doing this. And so I just first I went to my husband and said, okay, we got to figure something else out. Um, and yes, it does have to do with my thoughts of we should be able to make ends meet. But it also has to do with all around. This was not what I wanted to do. I want to care for people. And caring for people in an insurance model means I have a 15-minute visit. And that's not what I'm okay with. I want to be able to spend time, get to the bottom of things, and know that you have been heard. And so that's why I feel like it kind of just sped into something I didn't really want it to be to begin with. And I said, hey, I got to pump the brakes and we are going to start back where we began because I don't want to just be another doctor's office that you are cared for in a short little visit and nothing ever gets solved. So, whenever we get an appointment with somebody, if you accept insurance, then the insurance company wants a note from that visit. They have to have codes of everything you addressed during the visit. And then they, based on those codes, decide how much they're going to pay you. And with all of that, that includes the visit, the time we charted, the if we have to spend time getting records from someone else, reviewing those records, what we do whenever a medication isn't approved, if we have to resend medications or if we have to review lab work and then call with the lab results, all of that is included in that one visit. So then, whenever you are discussing, well, hey, can I just call you to get a refill of this medicine? That just means that if insurance then again asks me for a prior authorization, or they say you can't have that medicine any longer, we need proof. That means I'm going to either have to see you again, redo lab work, and do all of this other work that is related to that one visit that they've paid me for and you get no other payment. So if you come into the office and you're like, this is my preventative care visit or my wellness visit, that means when I put that code in there, nothing else can be discussed because they won't pay me for any of your problems that day. They only paid for that visit being a wellness visit. If you add another diagnosis code, they then say, we won't pay for either one of these. So then you get refiled. So then it's 43 days before you get that refile. And then you refile with one of the two codes, whichever one you choose, because now you're like, okay, which one do I choose? Because we were trying to do preventative, but they said, hey, I actually kind of my ear hurts today. That's not their fault. They should get to be able to be seen for their ear hurting that day too. But insurance says, no, you can't put that in there. So if you don't chart it, it wasn't done in the healthcare world. So if I just don't chart that they have an earache, then I'm in trouble if it ever goes to court. If I chart there's an earache and insurance says they won't pay for it, then I didn't get paid for it. I treated it. And so it's a very, very sticky situation for a provider trying to just do what's best for their patient. So often I know people are like, well, my doctor had their hand on the door the whole time when I tried to bring something else up. It's not that they're trying to not listen to you. They have to have you make another appointment for them to get paid to talk to you about this. And no, it's not all about money, but if we don't chart it, legally it wasn't done. So we have to chart it and we have to be paid for it because that's what we have a contract with your insurance to do. So often it gets lost in what we're trying to say isn't how it's, sent forward because we're not trying to say, I don't want to see you or I don't want to talk about that this visit. We're saying, I can't. And I have a contract with someone who says I can't. Um, because whenever we take insurance, we aren't contracted with you. We are not contracted with the patient. We are seeing you for your insurance. We have a contract with them. So we have to do it their way or no way, just like if you have a contract with somebody. And so that's why I feel like direct primary care brings it back to the heart of them and us, the patient and me, because we can say, this is everything we're going to talk about. We're going to talk about the 7 things going on today. It doesn't matter. Nobody's going to tell me that I can't talk to you about that because you paid me for my time and my expertise. And your insurance doesn't have to be involved at all. So if you have seen me, you know that I am not ever someone who's going to rush you in and out. I am not someone who doesn't listen. I always ask, do you have any questions, concerns, or anything else you want to talk about today? So I hope that they would understand that for me, it is about the connection and the relationship we are building. And with us previously, I ran this much like a DPC would be ran because I never ever paid attention to how long I was in a room. I literally just stayed until we were done. And that is a direct primary care model. That is not an insurance model. So if you are frustrated with the idea that I no longer can take insurance, that's because I was taking the time with you as an insurance patient, just like I would any of my direct primary care patients, because I truly care about you. And now that I can't sustain that with the volume system that they want us to do, I have to reevaluate how I do things. And I don't want to spend less time with my patient. So the only way I can reevaluate is by saying, okay, well, that means then I have to give up the contracts with insurance saying I can only spend 15 minutes in with a patient and I can only see them for one thing. And so that's where there's a lot of push and pull to that as far as being a provider, because I just want to care for people. And that has been very evident, I feel, in the way that I have been taking care of my patients. And so if you're not sure why I had to make the change, then I would invite you to please come and talk to me and we can discuss like the things we've discussed at each of your appointments. You'll notice it was more than one thing. We've addressed multiple things. We've done multiple different types of modalities to help you get better at each visit. And that is the direct primary care model. So you have been seeing a direct primary care provider under an insurance model. So with the membership-based direct primary care, it is not a huge amount of money out of pocket each month. It is for a single member adult under 55 years old in our clinic, it is $80 a month. And so with that, you can be seen as much or as little as you need to be seen in the month. There is no other bill. You will not get a copay. You will not get a deductible. You will not get a co-insurance bill from our clinic ever. It's the $80 and that is all. As well, you don't have to go to urgent care. If you don't feel well, you call us, you text us, you let us know. We will see you that day or the next morning, guaranteed. You will be able to be seen. And so that eliminates the copays, the deductibles, the co-insurance, the surprise bill down the road for urgent care even. So we are now seeing you for 70 to 80% of your health care for one low monthly membership rate. Then you don't have to worry about, oh crud, what's this bill from later on? And you don't have to be like, was I even seen that day? I don't even remember that. And it makes it where financially, you know what's coming out every month. You don't have to wonder what you're going to be hit with later. It makes it where if you have a family and you want to do the membership, our kids all get sick. They are constantly waking up with a sore throat, a runny nose, an earache, abdominal pain. You can come and see us. You don't have to wait 2 to 3 weeks to get into their pediatrician or primary care doctor. You just call or text and we will see you within 24 hours of what's going on. And that makes it where you can get a school note faster. You can get in to see somebody. You can get things started so that you can get to feeling better sooner. And so it's the peace of mind of knowing that you have access to care no matter what. And you don't have to worry, even on the weekends, about what do we do on Saturday. Just text me. That's it. That's why you have access to me with a phone number to text. So I think that the thoughts that I had first were, well, this isn't working. I don't really know why I can't make it work. And I know there's other people who can, but this isn't working for me. And I think the biggest thing was it didn't align with how I want to practice. And so that became a push of like, okay, so what does? How do I do this? How do I change that? Because I feel like I'm stuck in this situation. And so as I was just thinking through, how do I do this? How do I not see 15 to 20 patients a day and run them through here because I can't if I do that, I can't spend time with them. But if I don't do that, I can't pay my bills. So it became this really hard thing of, well, do I close one day a week and get a job? Do I decide that, okay, I've got to let someone go that works for me? That if I let them go, then I have to also take on that responsibility to do more work, which means how much less time do I get to spend with the patients? So I just really tried at that point to kind of search my soul, get real quiet, and figure out what aligned best with me, with who I am as a provider, with who I am as a person to care for others, and who I want to be. It's not all about money, but I have to be able to pay my bills because the amount of stress that you're under when you are financially strapped is not a long-term solution of being able to handle the decisions that we have to handle in healthcare. I have to be able to be clear-headed and think through someone's ailments. And when you have this big financial burden over here, like screaming at you, you can't do that to the best of your ability. I don't think you can do any job to the best of your ability, but definitely caring for others, like how I don't even know how that's possible because you have to be able to just think about the care and not think about all the other things. And I think that's also why being a healthcare provider is a very hard individual to own a business because we're not supposed to think about that. We are really in nursing school and even in nurse practitioner school. We didn't take classes on billing. We didn't take classes on coding. We didn't know anything about the financial side of things. And I can tell you my years in the ER, the minute the registration people walked in to get payment, we as nurses were told to walk out because we couldn't care what they were paying or not able to pay because I worked in the ER. And in the ER, there is a law that says you will see them no matter what their ability to pay is. So, with that, you don't really get that sense of you got to know the financials. So, when you become a business owner and you do have to know the financials, that adds a whole nother layer of stress into the healthcare model that is already in such a broken, just horrible situation right now. Often, whenever you go to a provider who is in conventional healthcare models of insurance based care, normal means you fit into the box of what these reference ranges look like. But really, what are these reference ranges? These reference ranges are what is the normal for the amount of people they take a sample of. These people are not the healthiest people in our society. They are just the common people in our society. So, is that normal for you? Who knows? We don't know that because if you don't feel well and you're having symptoms, then that number's not your normal. Blood pressure can be normal for lots of people at 120, but someone who's ran in the 160s for years, they come in and they're dizzy. And you're like, well, what's going on? And they're like, well, I don't know, but man, my blood pressure's been really low. Well, 120 over 80, if I check that, I'm going to be like, your blood pressure's not low. It is for them. So we have to look at healthcare more of if it's not normal for you, then we need to do something. And saying it's normal on a lab panel because that's our reference range is what we were taught very early in nursing school. You don't treat a monitor, you don't treat a lab, you treat the person sitting in front of you. And so if you're going to a provider and they're like, oh, that's normal, that's not right. You need to find someone who will listen to you and spend time with you to get to know what your normal is or what it used to be. So I would highly recommend that you find someone maybe who does more testing. It doesn't have to be every test under the sun. You don't have to spend thousands of dollars, but be able to get some of the things addressed. I can tell you for me, 4 years ago, I had never checked a vitamin D level in my life. I had no idea that that made people feel the way that it makes people feel. But then when I started checking it, everybody seemed to be low. And I was like, "What is going on?" And then when they would come back after being on it, they would say they felt better. And I was like, "Oh, okay." And then often I know younger girls, teenagers, young women get tested for anemia. They actually finally decided, okay, hey, when they come in and say they're tired, let's do more than just a CBC and a CMP to check those like electrolytes. And so whenever they started checking ferritin and iron panels, then they started seeing that, hey, these women are low. So if you're short of breath or if you're fatigued, you just don't feel right, there's many things you can check besides that basic panel. And often if you check the basic panel, it's going to be normal because you didn't check the right things. So being able to hear your patients and having time to spend with them, then you can find out what is normal for them. Like everybody talks about testosterone and how, oh, well, the normal is 250 to 1100 or 900, depending on what reference range you're looking at. But we never checked that person at 18. How do we know what their normal was? That's just the normal range of people checked today. But 50 years ago, the normal range that people were checked out was much higher. So, how do we say that's normal? You're fine. Go home. No big deal. You can't get off the couch in the evening. That's okay. Maybe you should sleep more. I mean, I don't really understand where we got so lost in checking the numbers rather than dealing with the patient sitting in front of us. Well, I often like to start with asking, of course, about them, but I don't go like, hey, what do you do? I'm often like, how many children do you have? Are you married? Where are you from? Do you live around here? What do you do for fun? Then I asked, what is the most exciting thing you have coming up in the next month? Because then that makes them think about something good, something fun. It relaxes them and helps them to understand I'm not here to check your numbers and walk out the door. I want to know you. I want to get to have a relationship with you. And this doesn't have to be like the old style. I walk in and tell you what's right and wrong, and you have no say in it, and I walk out. So that's kind of where we start our visits. I go over the normal things like what surgeries have you had? Have you had a hysterectomy? That's a big one for women, and we're tracking hormones like. But also we go through like, okay, so tell me like how was your sleep? Like with people who are saying that they have issues with fatigue. Do you drink a lot of tea? That rids your body of iron. Like, do you eat meat? If you don't, we might need to be checking some labs. So, based on their symptoms, then that kind of controls where I go with their questioning of, well, if you have fatigue, are you sleeping enough? Do you get up at night? Have you ever been diagnosed with sleep apnea? Because lots of people, even if they've been diagnosed, if they're not using a machine, they forget to tell you that they have sleep apnea. And so that can be the cause of headaches in the morning. That can be the cause of things whenever people are like, oh, I didn't even think of that. So just trying to think of them as a whole person and trying to be like, I'm not here to just address your fatigue. I want to know what is going on in your life. If someone comes in and they're so angry or they're upset about something, and most of the time I can ask them, can you tell me what's really going on in your life right now? This has nothing to do with this appointment, does it? I mean, if my staff offended you that bad for something they asked for, I really want to know why. I don't really, I mean, because it's not about the paperwork. It's not about what's going on that you had to fill out something extra once you arrive. it's usually something way deeper. It's usually something going on that is totally outside of my wheelhouse. I don't know what's going on in your. So I think the biggest thing is it comes down to being able to spend time with them and understand their situation from beginning to end. It's one of those things I think that also in healthcare, we have been so segmented that like the doctors turned things over to a social worker in the hospital if there was something going on in their social life or they weren't going to be able to go home with certain things and they needed things. And we cared for the patient while they were there, helping them get up and get down and things like that. But then a physical therapist came in, and then, so it's all segmented out so much that when you were in a primary care setting or even, weight loss or hormones, when you're in that setting, it's affecting every part of their life, not just this one area. So if they're not sleeping, they're not doing well at their work. If they're not sleeping, they don't want to work out. If they're not able to get on a blood pressure medicine and continue or stop having headaches, how are they going to function every day? We often tell children when they say, my head hurts all the time. When was the last time you had your eyes checked? Like, it's just some things that we don't think of on a daily basis when we're out and about. As a parent, you're like, yeah, I got their eyes checked last year. Well, but they've strained their eyes looking at a phone, looking at a computer at school, and it's not anyone's fault, but we're there to ask those additional questions that you may not think about. And that's what we're trained to do, to kind of dig a little deeper and get to the root of what is going on, which I think has been lost in insurance-based healthcare because we just have to run you through. We got to get to the next patient. We got to get to the end of the day. Got to get to Friday. Like it is a very, very broken thing that we have done. If you feel like you're being dismissed or you feel like you just can't find the right provider, and you're feeling like you're doing research online and you think, oh gosh, it must be this or it must be that, I would highly encourage you to go and just meet someone where they will sit and talk to you and they don't make it about your insurance or they don't make it about what they can do to get you in and out or what they can do in a time restraint. I highly recommend you try to get a relationship with someone rather than to just run through and, well, I just got to get this medicine filled. I think that that's the hardest part is people have to be heard and they have to be seen and they have to know they matter. And if we aren't showing that as healthcare providers, we shouldn't be doing this. You should find a different job. There are plenty out there. I would say you just have to be able to you have to be able to click with somebody and be able to sit and talk to them and know that they are the right person for you. And I think that that is where it has gotten so bad whenever the first question out of everyone's mouth is. And it's not our fault, it's not your fault, but the first question is, do you take my insurance? That doesn't matter. Like, that's not what should matter because that's not where that's what insurance wants us to do, but that's not what matters. I want to know that my provider cares for me, and I hope that's what my patients want to know about me, is I will care for them and I will do whatever possible to help them feel their best every day. So if you feel like you're not fine and you have been told that all the labs are normal, I would encourage you to come and see us. I would encourage you to bring what labs you have, to bring your medications. Um, do a journal for a week about how you've slept, what you eat, what time you go to bed, what time you get up, your stressors, what is going on in your life that is causing you some of the concerns that happen in life so that then we can go over all of it and look at you as a whole person, not as lab values. And if you think that you need more labs, or if I think you need more labs, we can run additional lab panels. But the biggest thing is that we need to address what is going on for the whole person. And running labs is not the only way to know if someone feels okay or if they're normal or not, because they're telling you they're not normal if they're coming to see you.